kind of, I think that's the number one confusion that many women have who maybe even are not aware the hormone replacement is even an option for them, which is sad, but it's getting better. But it's just the confusion as to what they are, why their body needs them, what's the benefits, what's the risk. I think risk, when you even say the word hormone replacement, is what lights women up, or they run the other way when you start talking about it, because there has been that stigma about this supposed risk about hormones.
Yeah, I think it's great. We can dive into like all of it because really, and you're
Hmm.
right. Like estrogen, for example, has gotten the worst PR forever. Like
Hmm.
it's like, and it's taken the bulk of the blame for practically everything, and it's
Yeah.
probably one of the most devastating things that we've done is actually make it out to be dangerous when it's not
Yes,
dangerous. And so,
absolutely.
and even this risk benefit, anything you do in life is like has a risk and a benefit. Like literally, the most dangerous thing I can do is drive on the highway,
Hmm.
right? It's like the
Hmm.
risk is really high of dying in a car accident, but I will not, but the benefits outweigh the risk. So I'm not going to give up
Yeah.
driving because the benefits outweigh the risk.
Right.
Hormone replacement therapy is the same. Like even, that study has been debunked. There's been a lot of
Hmm.
studies that show that there's probably not the risk that we thought that there was. But even if there was a risk, even if it is 1 in 10,000, let's say there's 1 in 10,000 risk for breast cancer, your chances of dying of heart disease are 1 in 3. Your chances of breaking a bone from osteoporosis are even probably greater than that, or dementia, or Alzheimer's, or colon cancers. Like, there's so many benefits to the HRT, and quality of life is huge too. So, I'll take that risk reward any day. So, if somebody were to tell me that my risk is 1 in 10,000 for breast cancer, but you're going to reduce all of these diseases of aging, have a quality of life, feel great as you're aging, look great, and potentially like not die of heart disease, like I would choose that any day. So I think women need to keep it into perspective. Like no doctor is going to get on here and say that it's risk free because nothing in life is risk free. So I think that you have to weigh these risks and benefits, but the risk is very small with hormone replacement therapy, especially if you look at like the different formulations and the age that you get started and preventing. So we can definitely dive into each like
Hmm.
thing individually.
I love this. Yes. And I love the risk benefit. Yeah, this is a conversation I have with many clients, because they have had that kind of that mindset, or even, that fear kind of imposed on them, in society wise, whether
Mm-hmm.
it's our mother's experience or lack of experience, with hormones. So we go into aging with this misconception as to what's possible. So we
And
naturally just
women
avoid what we don't know, right? It's
we
so easy
avoid
to
what
avoid.
we're
Yeah.
avoid what we're afraid of. I
Yeah.
think that the misinformation is intentional. If you want to control a
Yeah.
population, you put fear into them. You give them a
Mm.
lot of misinformation, and you make them afraid of something.
Yeah.
So this is no different for women. Like I think they need to look at it that way.
Yeah.
But women, they're still confused.
Yeah.
Their mothers were confused, and now we're confused. But you don't have any control over. Like I think women think that, well, if I just stay away from HRT, then I won't get cancer. And that's
Mm.
really the wrong way to think about cancer
Yeah.
because you don't have that much, one, you may not even have that much control over it. Or
Yeah.
two, that's not what prevents cancer.
Hmm.
Alcohol is what causes cancer, or smoking, or lack of exercise, or
Right.
obesity, or some genetic risks, or chemicals in the environment.
Hmm.
These are things that you can control. Like you can
Hmm.
control how much you exercise. You don't have to drink alcohol. That's your choice. Like you don't have to smoke. You can't control your
Hmm.
genetics, but stopping. I think they just think, and I get that they are like, well, if I just don't do
Yeah.
HRT, then I won't get breast cancer. That's a
Yeah.
false. They're telling
Yeah.
themselves a lie. Um, but
Yeah.
so women
Totally
need to
get
know
it.
that actually you could potentially protect yourself. So
Yeah.
being informed and educated and getting the right information is the first step for sure.
Awesome. Okay. Well, let's start at the top with that beautiful hormone, estrogen. So tell
Totally.
us about estrogen, how it works in the body, why it's important for women.
So I would say estrogen is our second most important hormone, actually. So it's okay, we can start with that one, but it's
Sure,
like
sure.
it is the one that we associate with femininity or the main
Hmm.
feminizing hormone. So it's what gives us characteristics of skin and hair and lips and breasts, and it's a reproductive hormone. But it also keeps our mind sharp, helps us
Hmm.
sleep, helps us maintain our body temperature. It helps us keep us metabolically fit, and then as I mentioned, those like three main concerns, it helps us with mood. It's not just progesterone and testosterone that help with mood. Like if women have a lot of anxiety or irritability or depression or brain fog, I mean, if you have vaginal dryness and brain fog, like women don't tend to connect their vagina to their brain. And these are exactly the cause. The cause is the same. It's estrogen. You're not going to treat brain fog with progesterone or testosterone. Estrogen is what treats that. And so the three main concerns that I was originally said are treated with estrogen. If you have no sleep, you have a lot of anxiety, and you're gaining weight, these are estrogen related. So the weight gain is like top three for sure for women.
Oh, yeah.
And estrogen, it gets this bad rap that it makes women gain weight. And this is not true. Estrogen improves insulin sensitivity. It removes the visceral fat, which is the fat that's around the organs, and moves it to the subcutaneous area, which is underneath the skin. So women actually need this fat underneath the skin rather than around the organs. It lowers inflammation in the body, which is basically like a disrupted immune system. That's all the inflammation is. And estrogen modulates the immune system, and it also boosts mitochondrial function, right? So all of these things combined, like when you have less belly fat, you have less, inflammation, then your risk for metabolic disease goes down. And we even know now from all this research on the GLP-1 injections, right? Like Ozempic and Mounjaro have done like great things because now we know this pathway. Estrogen will raise GLP-1 naturally. So like we even see these pathways that when estrogen declines, we see these pathways decline too. So it's not just like skin and hair, beautiful skin and hair and lips, but like when you even think about what estrogen does in the body, it's extremely hydrating. It'll make like it sucks moisture into the skin. So your mouth, your eyes, your ears, vagina, like everything gets really dry when your estrogen decreases. And this is super important. It's not just about like looks and sex. This is about pelvic health. This is about oral cavities. This is about basic health things that women need as they're aging, and estrogen is critical for them. They're even it's even critical for the health of the uterus. It gets like this bad rap of causing problem, like overstimulating the endometrial lining. But it doesn't do that. It stimulates it appropriately. That's what it's supposed to do. It's just that it needs the other hormone to oppose it. But its natural state is to be like it's doing its natural function in the body, which is a good thing.
Yeah, I appreciate all of that. And inflammation. Well, guess what? Type 1 diabetes is pretty much an inflammation, chronic inflammation type of living for us for many years, for a lot of us, many years. And another thing that you mentioned that is so important is how insulin, I think that's the number one thing that I experienced and the women I coach, the number one thing, and all the things that you mentioned, the sleep, the mood, the brain fog, and the weight gain, those things definitely are happening as well. But as living with diabetes, we are looking at our CGMs, we are looking at those markers. We see our A1C going up. We see that we need twice as much insulin to do the same thing we've been doing for years. That's the number one frustration. And I know estrogen is the number one reason that that's happening. So that's another marker.
Definitely. And it's hopefully you
Yeah.
catch it before then. So like the idea is that you want
Yeah.
to prevent it from happening.
Right.
Estrogen's really hard. Like hormones are very hard to use as a treatment. You can't really treat type 2
Hmm.
diabetes, for example, with the hormone replacement therapy, but it definitely has been shown to prevent type 2 diabetes. Like you can't really treat heart disease with it, but you can prevent it. And like type 1 is obviously a different thing, as everybody on the call knows, but I'm just saying that
Sure.
you when you see that you need more insulin, like these pathways are becoming disrupted, more dysregulated,
Yeah.
hopefully you will see the signs before then. We need to pay attention to
Yes.
mood and sleep and
Yes.
vaginal health and skin. Like if your skin's getting really dry all the time, hopefully that
Mhm.
happens before your insulin changes. Yeah,
Right. Yeah. And you bring up a good point because there's a lot of those. Yeah. The dryness is so much part of it as well. And that's a good indicator. So maybe if we went to our doctor and talked about the typical low estrogen symptoms and said, yeah, but everything's drying up. And my
it,
insulin is no
the,
resistance. And maybe they would pay attention at that point. I don't know.
they
But you're
they don't.
right.
They
Yeah.
don't pay attention. That's the problem, is
Yeah.
that you have to
Yeah.
be, because most doctors do not consider hormones that big of a deal. They do not consider them
Right.
to play a big role.
Yeah.
They're not trained on it. So they're not going to think of it. And even your person that's managing your diabetes is not going to think about it. So they're just not. So
Mm-hmm.
they're not going to give it the credit that it deserves. So you have to go to a specialist. So even then, like even the thought about, oh, hormone replacement therapy is only for women who have had their period stop for a whole year. This is a very traditional way of thinking about it. And if you wait until your period stopped for a year, you've almost waited too long. Like you should have been considering it much earlier. So don't like go to your regular doctor. Go to a specialist too, for
Yeah,
sure.
yeah, absolutely. Yes, yeah. So timing does matter. I think that's one of the things when I look back, I was full year without a cycle before I actually started on hormone replacement. I was down the natural route, I was doing some herbs, and I was good for a while until I wasn't.
Yeah.
And I really did kind of have it in my mind. I wasn't studying it at the point, so I hadn't gone to school to study it. All the education I've learned about it, and the doctors like you that I'm following and learning from, that just it had to I had to be retaught about really what my body needed, and that it wasn't a bad thing. And yeah.
Yeah.
It makes me, you're listing all these pros, which I've heard many doctors do as well. I love that you bring that up, because wouldn't it be nice if we just had a piece of paper, all the pros. I mean, the pros of hormones. The list is endless. And then you look at that, well, the little negatives, the what ifs, there might be,
They're
I
more what
mean,
ifs. Like they're
yeah,
actually more for birth control. Like those risks have been studied,
right.
and the risks are there for birth control, but even then those risks are very small, but they're usually
Yeah.
for like an oral birth control.
Okay. Yeah.
Yeah.
Yeah. Yeah.
Yeah.
Which is really more of a synthetic
But
form.
everybody blame
Right.
like they all
Yeah.
call them the same thing, because doctors are
Yeah, I
like, well,
know.
birth control's hormones, but they're not. So it just kind of
Yeah.
gets confused within the literature.
Yeah.
But when
Right.
you truly look at the literature, it's with those synthetic progestins,
Gotcha.
probably.
Good.
Yeah.
Yeah. Nice. Okay. So let's jump to progesterone.
Progesterone, I would say, is a
Yeah.
woman's main hormone.
Okay.
And
And
it's
this
the
is
most,
this
it's
is I'm
the,
sorry, I don't mean to interrupt, but that surprises me. So this is see, I even learn here on the show. So can't wait to hear how
and
it's the number one.
there you can talk about like bioavailability and maybe potency, because like estrogen is really potent, so you don't need a lot of it for it to be potent in the body. But
Okay.
when you look at the most abundant hormone, it is definitely progesterone. So progesterone is magnitudes higher than estrogen or testosterone, and it's supposed to be. And so you really don't want to be estrogen dominant or testosterone dominant. You want to be progesterone. It needs to be front and center. It needs to be the most abundant. And this is how the body is able to function best. Like your inflammation will be lowest, your metabolic system will be the most fit, your brain, your heart, your health, your bones. And even sexual libido and mood, and most importantly, mood, because women have this really complicated neuroendocrine system. So I would say their neuroendocrine system and their immune system are really, really important for women to maintain health and aging. And progesterone modulates all of this. So it's like progesterone and estrogen are the yin and yang. They counterbalance one another. Whatever estrogen does, it stimulates something in the body. Progesterone will make sure that it doesn't get out of control. So when I mentioned like the uterine lining, like being proliferated by estrogen, it's okay. That's what estrogen is supposed to do. It's like its normal thing. Progesterone is supposed to stop it and make sure that it doesn't get out of hand. Estrogen is supposed to stimulate the immune system. It's a good thing. Like you want it to be strong and robust and fight viruses, but you don't want to get it too out of control that you get an autoimmunity. So progesterone will come in, modulate it, and make sure that estrogen doesn't get out of hand. So progesterone, we've been given it only credit for pregnancy. We say it's only useful for the uterus. It's only useful for periods and pregnancy, and that's it. And if you get a hysterectomy, you don't get any progesterone. Our current formulations suck at delivery. They really do. Anybody that's listening, like, suck. We need to really like question what we're doing here for trying to get progesterone into the body. Like when you swallow it, it just gets degraded by the liver, doesn't go through the skin. So what are we like? Our most important hormone is really hard to get into the body because it's such a big molecule. So this is challenging for hormone replacement therapy that men don't have. Testosterone's like this tiny molecule. So like they don't have this problem, but we do. And so our doctors medicine needs to be looking at this, but it is screwed up too, like on labs. So even the estrogen looks like, let's say it's 300, your estrogen level is picograms per milliliter. The progesterone will come back at like, let's say 2, the number 2. But the units on it are completely different. and laboratories report it. But if you were to put progesterone into the same units as estrogen, picograms per milliliter, that 2 would actually be 2,000.
That is so interesting.
But when everybody looks at it, they think 2, oh, that's not that big of a deal. It's not that big of a
Yeah.
hormone, like it's not that much. But if the labs were, they just wanted to make their report shorter.